We're talking about infective colitis today, and I told you guys that anytime you see itis, it simply means there's an inflammation, right? So see, colitis simply means what? Inflammation of the colon, all right? The colon being the large intestine, all right? So we're talking about this infective colitis. So infective colitis simply means yes, there's inflammation of the colon, all right? But there's an inflammation because there was an infection, all right? Infective colitis. So we'll be talking about infective colitis under several headings like the cause, all right? We're talking about the symptoms, the diagnosis, the possible treatments that could be given for what? This infective colitis, right? So for the cause, now we're saying infective. So now the cause will be more directed towards what? Microorganisms that can cause infections in a human being, all right? So under bacteria, we have things like what? Salmonella, we have Shigella, we have what? Campylobacter, we have the E. coli, we have the Clostridioides, difficile, right? Then other viruses, we have things like the Norovirus, Rotavirus, and the CMV, that's the Cytomegalovirus. Under parasites, we have parasites like what? Giardia lamblia, Entamoeba histolytica, Cryptosporidium, right? Then looking at the symptoms, it's basically the same thing, right? Same thing as when we spoke about colitis in general, okay? Symptoms will still be the same thing, right? So the patient will be what? Having diarrhea, that's passing out bloody or watery stool, be having abdominal pain, having fever, feeling like to vomit or vomiting, right? Weight loss, fatigue, all right? How can we be able to diagnose an infective colitis, right? If you take a medical history of the patient, if you do physical examination of the patient, if you do some stool tests like the culture, when you are doing culture now, you want to now what? Be specific. You want to find out the organism that is causing the problem, all right? So culture, microscopy, polymerase chain reactions, all right? Then you could do what? Endoscopy. Endoscopy, that one is doing all those colonoscopy, sigmoidoscopy, all right? Then imaging studies too. Imaging studies like the CT scan, the MRI scan, okay, could also help you have a view of how the internal environment of the gastrointestinal tract is. All right. So this is what colitis, when there's inflammation of the colon, and the colon is another name for the large intestine. All right. What is the treatment? Yes, there could be inflammation, there could be bleeding. All right, the person is hypovolemic, so you want to replace their fluid. All right, electrolyte management. Then if it is a bacterial infection, you know that you want to use antibiotics, right? So antibiotics like what? Fluoroquinolones, azithromycin, metronidazole, all of that could be helpful. Then you could use antiviral medications if it is infections by viruses. You could use what? Antiparasitic medications if it is what? Infections by parasite, right? So antiparasitic medications such as what? Metronidazole, albendazole, and the rest, right? Is colitis. Then what is the complications of infective colitis? It could result into dehydration, right? The person will probably lead to malabsorption, so problems like that, right? Probably the person is bleeding internally, lose a lot of fluid, or the person does not have appetite, is not eating, all right? Lead to dehydration, right? This will lead to electrolyte imbalance, lead to septicemia, lead to what? Toxic megacolon. Then it could also lead to some chronic intestinal diseases. That's when the disease is left there for a very long time, right? So something for a very long time leads to what? Chronic situations, right? So I think that's just it for infective colitis.